So Layla expressed to us that she'd noticed these little horizontal lines that for her age are a bit more in your perception than her friends. And this is what is causing those horizontal lines, which is the frontalis muscle. Full name is the occipital frontalis muscle because it actually comes all the way from the back of the head and reaches around. Although that's kind of interesting, it doesn't really affect what we do mostly. Mostly there are enough adhesions that I think it moves independently. You don't often see the whole scalp moving. We want to relax as much of this muscle as we can without losing the support for the eyebrow. Particularly in a female, if you cause that drop, they're very unhappy. You can actually get away with it with men much more often because firstly, they don't put eyeshadow on. If you ask someone, you'll know this, but for the men watching, if you apply eyeshadow, you instinctively lift your eyebrows to do it. And that's the thing that women complain about. They can actually look okay at neutral. So when you look at them, they don't look like they've got a brow drop, but they're very upset by the fact they can't move their eyebrows. So that really helped me earlier on to realize it's not just about the appearance, it's about the function of the muscle and to leave some muscle moving as much as you can in most situations. Right next to it, right inferior to it, you have the next muscle we're going to be concerned about, which is the corrugator muscle. Corrugator muscle starts deep on the bone and moves its way as it crosses laterally to insert into the surface of the skin, usually just near the mid-pupil or slightly lateral from it. And you can see the insertion point, which is fibers directly connected with the surface of the skin when someone does a really big frown. Can you see if we can do that for us? Yeah, so this just here is where the insertion point is. Anything lateral to that is not going to make any difference to the frown line, but it does have a chance of affecting the frontalis muscle, particularly if you're a little bit on the deeper side, and that is going to cause asymmetry to your brow. So this is a very important point to know about. We need to be very superficial and low dose here, not just to protect for eyelid ptosis, because the levator palpebral muscle is very close. You can see that on this model here. That's the muscle we worry about with droopy eyelid. But it's actually the frontalis muscle that causes more problems. So if you go too lateral, you get asymmetry to the eyebrows if you've done it on one side and not the other. And you can also get heaviness to the eyebrows. So it's a very important point to isolate, know that you see the insertion point, and then inject. I usually say 5 millimeters medial to that insertion point. A couple of other interesting muscles. So the Procerus muscle, which pulls down here, not everyone has a very strong one. So let's see if you can show us your Procerus. You can see there's some downward pull. Not particularly strong, I'd say, Layla. Mostly she's pulling in this direction, corrugators with a little downward pull. You certainly don't need to put 7 units into that, which a lot of people do. You could probably do 2 units and you get the same result. Then you have the depressor supercilii, which some people consider just a branch of Orbicularis oculi, and it's a slight downward and lateral pull that does this when you frown, if you do a big frown again. And whether it's there or not, it's kind of academic. We're basically treating in the same place as the corrugator. The belly of the corrugator is in the same spot. So if we treat that sufficiently, we'll get those fibers as well. Okay, Orbicularis oculi, it has an origin medially and connections with the lateral facial ligaments here. The lateral canthal thickening here is ligamentous attachment to the skin. So when that muscle contracts, it tends to contract respecting where it's attached. So if you think of it, when this normally comes to play when you're treating someone with botulinum toxin is that if you relax the inferior part, the medial part will still pull towards its attachment, and you get this strange pull in some people in this direction. So we need to be aware that it's in a tug of war, but a circular tug of war, and wherever you relax it, you're going to get a pull often in the other direction, particularly with the other muscles. Now, this isn't always a bad thing because we actually use it for eyebrow lifts. If you relax this muscle here, if you close your eyes very tightly, you'll see what happens to our eyebrows. Eyebrow gets pulled down. And these muscle fibers here are pulling the eyebrow downwards, which means if we relax them, you're going to get the frontalis muscle unopposed, able to lift slightly more. So this tug of war will be in our favor if we relax here. Here it's not in our favor because we pull medially. The levator palpebral muscle runs all the way to the back of the globe, and its strongest portion is well within the globe behind the orbital septum. So the orbital septum is a very thick, if you see it on a cadaver one day, it's really quite a tough structure. It's not that easy for something to permeate through it, which tells me most of the eyelid ptosises are coming through being too deep. You've either gone through the orbital septum, or maybe there's some abnormality with the orbital septum, which is also possible, or maybe even through the little foramen above, because that's how you get into the globe. So depth is very important, and if you don't do that, you should enjoy many years without getting an eyelid ptosis. So if you could do a big frown for me. Now, just as we're talking about, I'm trying to see where the insertion points are. And you might in the beginning mark that out, because lateral to that is no muscle that we're interested in. Right there is the actual insertion point, but this is probably the safer place to inject, because it just means you're further from the lateral frontalis. I then go to the deepest and strongest part of the muscle. So I'm trying to predict where the strongest part is, and I'd say that's probably there. And then I might do the Procerus if you wrinkle up that. So we'll put a little injection in there as well. And it's basically repeating the same, finding insertion point, a little bit medial to it, finding the heaviest and deepest part. So next thing is the forehead. Forehead is actually the most difficult to mark up, because it's one of the areas where it's most clear that we're in a balancing act, because I need some muscle to move and some muscle to be relaxed, or I won't get a difference. And so most of your follow-ups are forehead follow-ups, because you have too much movement or too little movement, and you're either correcting for a bit of heaviness or you're trying to correct for too much movement and still having lines. But it helps to draw out the box that you know is safe to treat in, and this is my way of describing that. And there are lots of other ways you'll come across, but I like to try and base it on this principle that I want relaxed muscle and working muscle. So lower down, I want a bit of movement, and higher up, I don't want much movement. I also want a trend towards more movement laterally, because she's female. So I'd rather there was more movement here than I wouldn't be the end of the world, but I don't want heaviness at the sides, lifting in the middle. So in terms of preventing heaviness in the brow, it's about 2 centimeters, or in a very small forehead, about 50% of the forehead from the orbit that I leave untreated. So if you were to mark that on approximately using this pencil.
Where does the orbit start?
So good question. You can feel for that. It's very close to the underside of the eyebrow. Okay. So in Layla's case, you can actually feel just where her eyebrow starts is where the orbit is. So 2 centimeters above that should leave enough muscle functioning. I also then follow the contour of the forehead, so it's not a dead straight line. If I start with 2 centimeters here and follow around, that'll give me a good idea of where that safety zone is. Then you can follow this all the way around. So that's an area where, aside from where we're injecting here, which you can box off, we're not going to inject the other areas.
It's a no-go
So that's a broadly speaking, let's call it a higher risk area, not a no-go area, because sometimes you do end up going there. But as a first pass patient, you would probably not treat there. You're looking for areas where there is no muscle movement that you can basically ignore. So it's not a large area, but a little area like that where there's an aponeurosis. It might go down the middle of the forehead. Some people think it does, some people think it doesn't. But broadly speaking, the muscle does have 2 bellies to it, and in the middle is the weakest. So I tend not to put an injection right in the middle. So I can see this muscle kind of ending here as well. So as this tapers off. So I want to elevate the eyebrows based around where the arch of the eyebrow is. And so what I'm trying to get to happen is I want the muscle fibers that are directly pulling in that direction to be left untreated and as active as possible. And so the way I do that is I draw a line following where the eyebrow arch should be. You can draw a line from the base of the nose through the eye, middle of the eye, and then up here. And you can think of that as a vector. This is the direction that you want the muscle to pull. So once you've got the direction, we then need to figure out how much muscle to leave untreated. Because if you leave muscle untreated that is not part of this vector, you end up with ladder lines. So say this whole area here, lateral, is untreated, then she'll get lines that run all the way up the side of her forehead. So I want it to taper off. I'm trying to leave as little muscle as possible to do the lifting while most of the lines fade. And the way I've learned to do that over the years is to start with the base of the eyebrows in measurement and choose the same amount each distance apart, which is approximately where that is, where the mid-pupillary line is. And then you can draw a line. It mainly lateral messes about the medial line, because lateral to this is no muscle. And this becomes another boundary. This is where I don't want to treat if I want eyebrow lift maximum. That's a key word. If I want maximum eyebrow lift, which therefore is not super maximum, it's not super high in your case because your forehead is smaller. On a big forehead, you can get ridiculous eyebrow lifts. But I still might soften that, but that's just giving me my first boundary. But the concept here, once you're treating this part of the forehead, is to fill with enough injections that you reduce the strength of the muscle evenly throughout. And so I would normally start right up against the boundary, remembering that each injection actually spreads about 1 to 1.5 centimeters. So if I inject there, it's more like a finger-sized injection. So if I do that all the way along, I won't draw all the circles, but essentially that's what I'm imagining in my mind with these injections, and I can fill the space, and you can fill it any way you want. So let's move on to Orbicularis oculi. So this muscle, very superficial under the skin at about 0.2 millimeters. We don't need to be deep. The deeper you go, the more you get the side effects. Side effects, lateral rectus, tear duct, and the one I forgot to mention earlier is the zygomatic muscle. Never seen someone actually get that, but if you go deep straight through the cheek fat, then you hit the origin of the zygomaticus major, and they'll get an asymmetrical smile. Miserable. Okay, so I'm picturing now sort of Ray-Ban shape muscle that splays around the whole eye. And if you ask her to smile, you can often see the contraction of that bulge here. So that's actually where my most effective injections will go. I usually tailor the eyebrow, pretty safe place to start. Actually gets more complex as you go inferior, lateral canthus, and then just near the cheek, near the lateral lid cheek junction. And then I'll do a couple of minor doses here. I sense check everything and just check that it looks broadly symmetrical and you haven't calculated something incorrectly. Just like with your, remember GCSE maths, my teacher always would say, now look at the number and say, does it actually make sense?
Yeah.
And it's a bit like that. Okay.